Hi, Anna. Can you
Good
please, good morning. Can you please start by introducing yourself and your practice?
Yes, I am Dr. Anna Murdoch. I'm a chiropractor and I'm co-owner of Align Medical Center in Wellington, Colorado.
Awesome. So, in a nutshell, how would you explain what a chiropractor does to somebody who's unfamiliar with the profession?
So at my practice, we focus a lot on total health and well-being. The goal of our practice is to help people look good, feel good, and be healthy. That's our main goal. And so on the chiropractic side, I do that largely by managing patients, musculoskeletal, neurological complaints. I do a lot of like therapeutic exercise and rehabilitation in conjunction with chiropractic adjustments and corrective type care to eliminate some of those health concerns for patients.
Awesome. So, can you, I know we were just talking before about how you have what's called like an integrated practice.
Mm-hmm.
Can
Yes.
you explain like what that is and how you are such a badass because you actually started this practice?
You. So integrated means that when you come in to see me for chiropractic care, you are also part of your initial exam would be with our family nurse practitioner who has a strong focus in physical medicine. So in that sense, you get two providers putting eyes on your complaint or your problem. So you get two different perspectives and different options on how you can treat or manage that concern that brought you in. So Stephanie, our family nurse practitioner, she's very well versed in like non-steroidal joint injections, trigger point injections. Um, she does a lot of medical weight loss as well, and she's dry needling certified. And then on the chiropractic side, I can help manage with chiropractic adjustments, corrective chiropractic care, therapeutic exercise. And then I'm also dry needling certified, so we can then, co-manage in a lot of these different areas. So having the option to get your concern addressed in such a wide variety of options in the same place makes it more likely that a patient is going to be compliant with their care. They come to one place, they can get their injection, they can get their adjustment, and they can get their exercise prescriptions all in one place. So our patients, get better very quickly in that model.
I love that. That's something I do like a whole lesson on that in the course because it just all comes back to the patient-centered care, right? Like the idea
Right.
of like it's not about me, it's all about you as a patient. What do you need? Like and you're able to
Right.
offer that to somebody, which is really rare. So we were
Mm-hmm.
just saying like do you know like how many of these centers do you think include chiropractic in our country?
I have no idea.
Yeah, me either. I don't you don't hear about them a
No,
lot.
there's a few. I mean, there's some different like spine correction centers in Denver,
Mm.
and they use chiropractors and MDs. I think that we still tend, even with the medical side of our practice, to be very holistic, very conservative in our treatment options. So we're not offering steroid injections. We do non-steroidal injections. We do a lot of lifestyle and nutritional consultations and coaching for patients so that we can use those medical interventions if needed, but we really want to be teaching patients how to care for themselves without needing some of these more extreme interventions. So trying to be as holistic as we can while also being able to do some medical management when necessary.
Oh my gosh, I love it.
It's really fun. It's fun. I love working with another healthcare provider. I mean,
Mhm.
as a chiropractor, you go through so much education, and we have like our zone and kind of our focus and what we look through our lens at. So then to see, hey, how does a nurse practitioner with physical medicine background and pain management background, how does the medical system handle some of these things? And then how can we marry those two together? To give patients even better outcomes with less medication. So it's pretty fun.
which is what we need. I mean, I'm teaching about that in the course too, how like that literally, I mean, that would solve so many issues if we had more centers like this in our country because it would
Mhm.
cost less money, right? Like
Yep.
for the actual healthcare system that's obviously not doing so hot
Mhm.
in our country,
Yeah, absolutely.
and it takes the pressure off of a lot of primary care physicians who are just going to refer out anyways
Hmm.
for
One
something
of
like
the
that.
number one reasons people go into urgent care or the ER is like back pain, headaches, and these are all things that could be effectively managed in these smaller private practice sectors.
Right. Yeah. I just love that you're doing that. But this is why Anna is even more of a badass because what do you do on the weekends? Then you adjust horses. Can you
Yes.
talk about that for a sec?
Yeah, so I'm a certified equine and canine chiropractor. So I completed the education through Options for Animals in Wellsville, Kansas. It I did the intensive 6-week course, and in that setting, I had the unique opportunity to learn beside other chiropractors, but also doctors of veterinary medicine. So a DVM and a chiropractor took the same exact course, and we learned the same education to do the animal chiropractic, and then being able to practice alongside that medical profession as well. I just learned so much from them. So on the weekends, I do see horses. I have some dog clients right now, not as many as I used to have, but yeah, so I'm helping horses with pain issues, changes in performance, arthritic symptoms. So a lot of my horses are either an elderly population where their owners want to keep them really comfortable and functioning, or I have these performance horses that are being asked to do quite intensive athletic endeavors, and they have some pain issue that comes up. Lots of SI joint pain, lots of low back pain, sometimes cervical or upper atlas issues arising. So that's what I do in conjunction with the integrated medical practice.
And she has two children.
I do have 2 kids.
Yes. And like a million other things on your plate. You're kind of a rarity, I would say. You're not the usual 9 to 5 chiropractor that one
No,
might run
no,
into.
it's so crazy. The summer fills up. Like I've got people calling me. They're like, I need my horse adjusted. And I'll be like, okay, bring him over. It's like 8 o'clock at night. And I'm like, oh, just go adjust him quick. Like, let's get him taken care of. So
Yeah, no big deal. Then go make dinner, just kind of.
yeah, yeah.
Wow. Oh, that's so cool. I really hope that you can get a video of you adjusting a horse for this course because I think when
So
somebody hears that, they're like, what? Like, how does she
I
even?
know everyone's like, how do you get the horse to lay down? I'm like, they actually don't lay down. They just stand there, you
Yeah,
know?
yeah, right. Yeah. But you have to use a ladder, probably.
I stand on
Maybe.
a large foam block.
Mhm.
It's like 2 feet tall and 4 feet wide. It's very large.
You kind of like
So
get
that I can,
around.
yeah, so I can get up or over their back. I use the foam block for safety, right? So a ladder or a step stool, a horse could step in, get their leg caught, you know, see what I mean? This big foam
Oh,
block that's got like I have like a leather covering on it. If they step on it, they just like they can't hurt themselves on it. So
oh, that's so true. I didn't think about that. Yeah, because they might get flustered if they're not
yeah,
sure what
yeah.
is happening, or yeah.
The first adjustments can be a little like they can be a little nervous or anxious, but usually the second time I work with them, they're very relaxed, very comfortable. So
Oh,
I know what to expect. It's really
they know
cool.
you. Yeah.
People are always like, well, I don't know if chiropractic works. I'm like, well, then you need to come watch me adjust a horse because it's either going to work or it's not. There's no placebo, you know?
Yeah,
And
it's
so
so
many
true.
of
Animals aren't gonna like,
be like, oh, I think that helped me. So I'm always like, if you think chiropractic doesn't work, adjust a baby or a horse and you will see a difference in how they respond. There is nothing in
yeah.
their mind that's going to be like, oh, this is. in my head, it's
Well, she's
better.
nice, so she must be helping me. I know. I was gonna say infants are the same, yeah, or especially
Yeah.
like toddlers are probably the biggest because they're
Right.
very opinionated.
Oh yeah, they'll let you know right away if it's good
Yes,
or
they
not.
will. Oh my gosh. So
So,
what's like a going back to your clinic, could you
mhm.
just like briefly give an idea like what your day is like?
Yeah. So we pre-shift at the start of our day. We pre-shift with the medical team and the chiropractic team together. So our medical team consists of right now nurse practitioner, two nurses, and then I have on my side me and then one chiropractic rehab assistant. So we pre-shift on the schedule because we share so many patients back and forth. So we say this person's in this room, that room, you're seeing them first, I'm doing this person's getting this exercise, kind of like going down what the day to expect. And then we start seeing patients. So I have open adjusting in the front of my office. So I see anywhere from 2 to 3 patients in a 15 to 30 minute time block. And then if I am dry needling, those are in private rooms. So those, I'm kind of going from adjustments to dry needling, coming back out. My rehab technician, I'm often, as I'm working with the patient that day, as we're going through their care plan, I'm sending her what exercises I want her to teach and what packets to be sending home, and therapies that patient might be doing in the office. When we process new patients, we utilize x-rays in the practice. So I'm, regularly analyzing x-rays, writing radiology reports, and putting together treatment plans for our patients. Now, when we do treatment plans, since every new patient is filtered through both the medical and chiropractic side, I work with Stephanie, our nurse practitioner. We co-create the recommendations for care based on what the patient comes in with. And I try to work out on my lunch break when I'm not having to catch up on documentation. And so it continues. So it's
Awesome.
fun.
Yeah.
I'm not a super high volume practice. Our setup right now, because we do, a patient might be in the office for anywhere from 15 to 45 minutes based on, what sort of rehab they might be doing if they're seeing both providers. Just a second. Oh, it's right here. And so, a patient might be in the office for 45 minutes. So I'm really seeing anywhere from like 30 to 40 patients a day.
30 to 40 patients a day. Holy
Yeah.
moly.
Mhm.
While managing as well.
Yeah. So, I mean, there's always the office side of things. Like Stephanie and I have kind of divided and conquered. So we kind of call her the CEO and I'm the CFO. So I'm the chief financial officer. So I manage payroll, taxes,
Insurance, that kind of
insurance,
Mhm.
employees, things. And she manages a lot more of the marketing and kind of the business development side of things. So there's some crossover there, but we've definitely separated some of these tasks that have to be done to keep the practice up and going. Those new patients are the lifeblood of the practice, but you need to make sure you have all the systems in place to handle them.
Yeah, well, dang, sounds like it's working.
It is. We've been in practice here for 2.5 years, and I feel like we're finally kind of leveling out and kind of hitting our stride of things are running pretty smoothly.
Good, good. Oh, that's awesome. So what's like your number one most rewarding or like favorite part about your job?
Um, I think it really is the like how quickly we've been able to help people feel quite a bit better. And when they see quicker results, most people are coming in for a pain issue, right? So it's been cool to say, hey, we've really helped you get out of pain very quickly. That then they're very bought in on how do we make sure that this doesn't happen again and what lifestyle changes need to occur to be preventative.
So they're more proactive, I feel like, than
I think so,
Yeah.
because they're, like I said, they start to notice these changes rather quickly, and they're like ready to jump on that right away. And I think that's been, that doesn't happen all the time, but I will say that when it does happen, that's extremely rewarding and it's very fun. Patients are like, I've tried so many things. I've had this chronic issue for years, and you've finally been able to help me resolve it. And they're so thankful.
Yeah.
So, I
Yeah.
mean, that is
That's
at the
fun.
end of the day why we all became chiropractors, right?
Yeah. Yeah. Yep. Totally.
There was some desire to help people in whatever way we could. So,
Yeah. Yep. Oh, I love that. So like, what would you, I have about two more questions I want to ask you, but I'm just
mhm.
thinking since you just said that, when you were trying to like get into chiropractic school and stuff, like what would you tell somebody who is interested in becoming a
Don't be a
chiropractor?
chiropractor unless you want to run a business.
Why do you say that?
There are really good opportunities to work in different settings as a chiropractor, but I'd say like 75% of chiropractors end up running their own practice, and they end up doing things that they never thought they'd have to learn how to do, like accounting and payroll and QuickBooks and marketing and Google ads and Facebook ads and online marketing and insurance billing and
Email
coding.
and
And so, like, I don't think that when I got into chiropractic school, I really understood how much of that was going to be on my plate, in addition to the stress of patient care. It wasn't until I kind of got further along in chiropractic school and started actually thinking about my like job options. I was like, "Ooh, this is interesting."
yeah,
This is a
yeah,
lot, you know?
yep, yeah, because chiropractors are notorious for it's really hard to work in a clinic that doesn't feel right, I should say, like associating or work, just you can't just
Mhm.
go and get a job at a chiropractic office and expect it to be just right for you because they're all pretty individualized at the end of the
They're
day.
very unique, right? So then
Mhm.
if you're trying to work in a certain area. So for example, I was trying to live in Cheyenne, that's where my husband lives. My job opportunities were quite limited. There's only 14 chiropractors in Cheyenne, and only one of them was hiring. So, when I was looking at that associate, I didn't have a lot of options. So,
Right, right. Yep. Yeah, it's definitely something that you have to think about.
or have and there's chiropractors though who do things outside of patient care, right? Yes. Um,
Yeah. Yeah, exactly.
they work with
Nutrition.
radiology, or like uh, at the VA, or they work with Optum to do prior authorizations, but then you have to decide that you want to do a lot of paperwork. So it's just
Yeah.
different.
Yeah, it is. And I don't think people know that about about
Mhm.
the profession, that it's not like a nursing job where, it's pretty much going to be the same, I would say, for the most part, depending on the hospital, but it's just like it's a nursing job and it's
Right.
expectations are the
Your
same.
roles are fairly established.
There's tablet versus right in chiropractic. So
You have
cool.
such a wide variety of options of things you can do, like within your practice, to make yourself, different techniques, different populations, different specialties. Um, so there's a lot of options, but also to have that option, many times you're having to run your own business.
Yeah, that's great advice. I feel like that's something that I have not talked about as much in the course. So that's really, thank you.
Yeah, well, because at this point I've opened, two different practices, right? In my 10 years of practice, I've opened two practices. I've been an associate. Um, I've started my own animal chiropractic business as well. So I guess three businesses. So, I've had a little experience in that entrepreneurship round as well.
Yeah,
Okay.
your feet were already wet. You
Yeah.
you were in it. Yeah.
Mhm.
Awesome. Well, do you have anything else that you would like to tell the students taking this course? I mean, they're interested in possibly working in healthcare, not particularly chiropractic, but just learning about what chiropractic is so that they can, be able to professionally talk about it with their colleagues in the future or refer or whatever it
Mhm.
may be. Do you have any last thoughts for the students?
Gosh.
I know it's a loaded question. If you don't
It
have
is
any,
a loaded
that's
question. I have
okay.
like a couple of directions I could go.
Yeah.
I think one of the biggest things is that I learned probably only in the last couple of years of practice. I feel like in healthcare, when we first start practicing and we're treating patients or we're assisting patients, we put a lot of our value based on our patients' outcomes. That was something that was really stressful for me in my first years of practice. Like I'd sit in bed at night and think about this patient who wasn't getting better. And I would like doubt myself in some way that, am I managing them right? Is this the right thing? Do they need something different? Am I providing them with, the right care? And I think what I've learned in the last couple of years is that, you are going to have patients that you can help because they're actually willing to engage. And then there's going to be other patients that they're not actually willing to change anything and it's outside of your control, and how to like separate that of like that patient's going to make their choices. You can only provide so much, whether it's nursing or primary care or chiropractic or physical therapy. Like at the end of the day, the patient has to show up. And if they're not going to show up, like you can't do anything about that. And it has nothing to do with like your value as a person or your ability as a provider necessarily. So that's something that I think when I'm talking to people in healthcare is the burnout there is so real, because they start to feel like maybe they're ineffective if a patient doesn't improve, and it's not always your fault.
Yeah. Oh, it gives me chills because it's so true. I think anybody that's worked in healthcare is going to feel that way, quite
They,
honestly. Like
yes,
even
and that's
dentists, doctors, dentists, PTs, like you said, massage there, but whatever it is.
oh my gosh, the number of times people have come in like, well, I tried PT and it didn't work. And I was like, but did you really try?
Yeah, because you got to really commit if you're going to do
You
PT,
gotta commit. It's the same
right.
thing with chiropractic. Like I went to a chiropractor one time. I was like, did you let them do their exam? Did you let them do the diagnostics? Did you follow through and give 6 to 8 weeks of tissue healing time to actually get better?
Right.
And they're like, no, I went one time. I was like, well, you don't do anything in medicine one time. You don't
No,
take one antibiotic. You don't take one vaccination if you get vaccinations. You don't
right.
take one high blood pressure pill. Like this is something you do consistency over time. And so when you start realizing that many times when people like that didn't work or you didn't help me, a lot of times there was either a lack of education to that patient to understand how the process worked, or they weren't ready to actually make any changes, and that's outside of your control.
Yeah.
As you
Yeah.
can tell, I get a little excited about that topic
Yeah.
because
Yeah.
it's so hard. You have a provider who wants to give of themselves so much, and they put a lot of effort and time into managing that patient, and then to feel disappointed when the outcomes aren't exactly what you'd wanted, it can be very disheartening to then show
Yeah.
up to work the next day and do it all again.
Yeah, I know. And then to look at it from the other side, like when you're able to work with somebody who is like, I'm in, tell me what to do. I will do what you tell me and I will stick with it, and they get better. It just feels so good because it's like,
It
man,
feels so good.
you did it. That's exactly what I needed you to do. And you did it. And I
Right, and it worked.
able to connect and it worked and you're doing better and you're able to get on the floor, play with your kids or ride your bike or do that 5K,
Right.
whatever, like you can,
Yep.
but it's not everybody.
No,
Not
it's
everybody is
not.
committed to, and that's okay.
Yep.
But yeah,
So that's what I'd say is, there has to be a good bit of resilience, and then the ability to separate your value from your patient outcomes sometimes.
that's great advice for somebody who's interested in working in healthcare because it goes across the board.
It does.
I have
Totally.
family member, like she won't take her medication that her doctor has told her, and she's like, you got to take this medicine, but they won't stick with it,
Right.
so it's no different.
Yep.
So
That's exactly
yeah.
it. There's
Yay.
no one and done in healthcare.
Yeah, that's great advice. Well, thank you so much. This has been
Oh,
so
you're
fun. This is
welcome.
so much. Oh my gosh, this is going to bring so much value to this class. I just know it.